people. They are in waiting.
I think Dr. Adhanari has joined.
Good morning, sir. We are live now.
A warm welcome to all our participants. Before we start officially, I would request Ms. Shruti to start with some Carnatic songs actually. So meantime, we are waiting for our guests to join with us. Almost all are here, but still I am expecting few more. And I request Ms. Shruti to sing some Carnatic songs for us.
Ma pa da sa sa pa ma pa ri ma pa da pa ri ma pa da pa ma ga ri sa ri ma ga ri ga ri sa ri ma pa da pa ma sa ri ma ga ri ga ri sa si ga na sindu karuna karivadana lambodara lakumikara amba sutta amara vinuta lambodara lakumikara Siddhacharana Gana Sevita Siddhi Vinayaka Te Namo Namo Lambodara Raghumikara Amba Sutta Amara Vinuta Lambodara Raghumikara Sakala Vidyadi Pujita Sarvotama Te Namo Lambodara Raghumikara.
Thank you, Ms. Shruti, and I welcome Supraja for the next song, please.
Good morning, sir. Good morning, everyone. Prabho Ganapate, Prabho Ganapate Manasa Smarami, Prabho Ganapatim Manasa Smarami. चांद वणंगी तुदी पाड़ी आड़ी उंदन सन्नदी शरणடைந்தோமே चांद वणंगी तुदी पाड़ी आड़ी उंदन सन्नदी शरणடைந்தோமே शांत सिद्ध सौभाग्यங்கள் யாவையும் தந்தருள் சத் Guru Niye Prabhu Ganapate Prabhu Ganapate Prabhu Ganapate Paripurana Varvarulvaye Prabhu Ganapate 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 Thank you.
Thank you. Thank you so much. I would like to welcome Dr. Ardanari. Sir, are you here? Sir, your mic has not connected, sir. Kindly check. Sir, Dr. Ardanari. Yes, almost we are having all our guests here. And before, yes, let us wait for our chief guest to get connected properly. Meantime, I'll request Shruti to sing a small prayer song again. Is it possible, Shruti? Are you ready? Yes, don't wear the headphone. You just go on without headphone. Yes, sing now.
शारदे जय जगवन्दिते शारदे जय जगवन्दिते सरस्वती माते जय गुणदाते वर शुभदाते शारदे सरस्वती माते जय गुणदाते वर शुभदाते शारदे ब्रह्माणि भक्ति गायत्री सावित्री सुरनर पूजिते ब्रह्माणि भक्ति गायत्री सावित्री सुरनर पूजिते
Morning.
शारदे जय जगवन्दिते शारदे जय जगवन्दिते श्रीपद्मनिलये
Problem
ज्ञानमुद्राङ्किते वरदण्डमण्डिते वीणापाणि श्रीपद्मनिलये ज्ञानमुद्राङ्किते वरदण्डमण्डिते वीणापाणि शुभ्रवस्त्रान्विते ब्रह्मस्वरूपिणे शुभ्रवस्त्रान्विते ब्रह्मस्वरूपिणी सरस्वती माते जय गुणदाते वरशुभदाते शारदे ब्रह्माणि भक्ते गायत्री सावित्री सुरनर पूजिते ब्रह्माणि भक्ति गायत्री सावित्री सुरनर पूजिते शारदे जय जगवन्दिते सत्कीर्तिदायिनी श्वेतपद्मासने सम्पत्प्रदाते विद्यालक्ष्मी सत्कीर्तिदायिनी श्वेतपद्मासने सम्पत्प्रदाते विद्यालक्ष्मी शुभ्रवस्त्रान्विते ब्रह्मस्वरूपिणी शुभ्रवस्त्रान्विते ब्रह्मस्वरूपिणी सरस्वती माते जय गुणदाते वरशुभदाते शारदे ब्रह्माणि भक्ति गायत्री सावित्री सुरनर पूजिते शारदे जय जगवन्दिते.
Yes, thank you. Thank you so much. Officially, we can start now. And I request Supraja to start the prayer song. After that, Duna madam will take over. Then I will give the speech. Is it okay, Duna madam? Are you ready? Supraja madam? Before that, I welcome all the guests in Zoom meeting and all
Yes,
the
sir.
participants in Fitness and YouTube Rehab channel. Welcome Ruchi madam, Mariam madam, and many are there. Vijay Selvan sir, all. I welcome you all. We will officially start now. And prayer song by Dr. Supraja. Please.
Mahaganapatim manasa smarami Mahaganapatim manasa smarami Vasishtha Vamadevadindita गणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दितमः गणपतिम् महादेवसुतं गुरुगुहनुतं महादेवसुतं गुरुगुहनुतं मात्रकोटि प्रकाशं शान्तम् महादेवसुतं गुरुगुहनुतं मात्रकोटि प्रकाशं शान्तं महाकाव्यनाटकादिप्रियं मूषिकवागणमोदगप्रियं महागणपतिं मनसा स्मरामि वसिष्ठवामदेवादिवन्दितमः गणपतिम्. Thank you, sir.
Thank you so much. Duna
Thank
madam.
you so much, Supraja. Hello, everyone. On behalf of Team EXRS India, myself, Duna, wish you all a very pleasant morning. I would like you to call upon very friendly and guiding orthopedic physiotherapist, founder of EXRS India organization, Dr. R. Chandra Mohan, to present welcome address to greet all respected guests, resource persons, participants, and all well-wishers in this India's first ever free international e-conference titled COVICON' 2021. Thank you, sir. Kindly start, please.
Thank you, Duna madam. Thank you so much for the kind introduction. Good morning, one and all. Good morning, all the distinguished guests present here in the Zoom and all the participants in our YouTube channel. This is Chandra Mohan. So I was scrolling down the WhatsApp messages in one day, and I read messages which were related to COVID, inquiring about, can I take vaccination for COVID? What can I do post-COVID? What can I teach for my family members, relatives who recovered from COVID? And many more questions are there. Clearly, I know I'm not the right person to answer them because my field of interest is musculoskeletal. So I'm not the right person. So, curious to help them, I called a renowned physiotherapist to arrange an hour discussion or a webinar session, we can say. During discussion, he told that it will take minimum 7 hours or 8 hours to give the lecture. Only we give that much time, the session will be fruitful. So 1 hour will not work. So further, I asked him, is there any possibility we can go for a conference model? So we can invite more resource persons. So that will be different. Making one person to talk 7 or 8 hours, that is not fine at all. We should think of their health also. So while chit-chatting like that, he agreed with that. Notifying that time our IAP is circulating that guidelines PDF. Even I went through it as a musculoskeletal physiotherapist. Even I couldn't get what exactly they meant it. So maybe many of our physiotherapists also facing the difficulties to understand all those terminologies or the protocols properly. That's why we spoke to a renowned physiotherapist here. Also, when we read and listen, our brain has less capacity to understand. But when we listen to a speech and then go and read, it gives more insightful learning and meaning. Then the same day, I spoke with Dr. Annamalai and Dr. Annie Madam, Annie Thomas, and Professor Narasimhan sir, and they all agreed to help me. Later, we approached Dr. Savita, Dr. Maria, Dr. Aranmaya, Dr. Sendil Kumar. they all gave their valuable suggestions. And we always have our support from Dr. Bhaskar, Dr. Rejisha, and Dr. Shankar. When we planned for the conference, we are not sure that whether it is simply a webinar type or e-conference, full day e-conference or national level. But Professor Narasimhan helped us to make it to international by suggesting to approach Mrs. Reshma Pavin, who is a physiotherapist in Hamad, Qatar. So all said, now the problem is, how fast can we do? So it was a very short notice. Even not even we have finished 2 weeks exactly. So I spoke to my team, Tuna Madam and Dr. Rupesh, and they helped us to make flyers, PDFs, brochures, everything. Registration, especially registration links. When I said that there is a plan, the same day Tuna Madam said registration link is ready. So I did hold. No, we have to make brochure and all those things. So she made it ready, and invitations and other parts, Rupesh took care, and verifications, all those things. We have arranged volunteers also to take care of attendance. So it's free doesn't mean that you can simply register and download certificate. All sessions attendance is must. There are 15 volunteers taking attendance to cross-check extra 3 and to completely check extra 1. They are all in YouTube now and they are taking attendance. So this is how we set to start our first ever India's free international e-conference. Wait, listen, dear friends and participants, all our resource persons spend their valuable time in treating COVID patients for past more than 1 year, wearing PPEs and also saving their lives. Okay, they are surviving during these difficult times, collected data, and they are going to present in front of you. And they have proper hygiene, safety measures, and good health to stay alive, teach us today. So they are here to share their valuable experience and knowledge with us. We should value their time, and we value all our participants' time too. Okay, so we are ready to give you all the very best experience of the learning. And suddenly, it's a conference, so there should be some other activities. So e-poster has come in my mind. Immediately, I called Dr. Annie Madam, Annie Thomas, Dr. Arun Balasubramaniam, Dr. Vishnuvardhan, and Dr. Alagappan. They helped me to come out with a better template and ideas, criteria, and what else needed for that, even for the team. So they helped me, and the last date of submitting the abstract is 10th June, and we are going to have e-poster post-conference e-poster presentation on 13th June. And we are having juries also. They are also present here now, and we will be introducing them later. To know whom I have called first, that renowned person, and how this COVICON 2021, the India's first ever free international conference, is happening, stay tuned with us. So we are having 2 days of session, scientific sessions. Each day we are having 5 lectures, and today we are having 5. Tomorrow we are having 5. Before I announce the details, we would like to invite our special guest. Dr. Athanari sir is there, but his mic is not connecting. So what I suggest, whenever you are possible, sir, connect with us. We would like to listen to you. So we will be wait in 2 days, anytime when we are on live, we will be welcoming you to give a physician's perspective of COVID. So no worries. And with that note, I welcome Dr. Athanari, Managing Director, Sri Gokulam Hospital, Sri Gokulam Super Specialty Hospital, Salem, Sri Gokulam Institute of Paramedical Science. I am proud, that's where I studied my UG. When I was studying in Gokulam, he calls us to volunteer for the camps, especially for bringing awareness about road safety and road traffic accidents. So it's not just a camps. It will happen for 3 days. Minimum of 50,000 people will walk in. and maximum it may go beyond 70,000 or 80,000. So also he makes in-house camps also, in-campus camps actually. These are the activities during my younger age, during my UG period, made me to think that I have to do something for the society. Maybe that's the, maybe I don't say that whether I got inspired or not, but that moment made me to do something. Okay. But later, that helped me to organize more camps in Attur, Tindivanam, Tirupur. So we have done more than 15 camps for the public awareness. On behalf of the students of Gokulam and also on behalf of all Indian physiotherapists, I feel happy to welcome Dr. Ardhanari as an alumni. And we will be waiting for you, sir, to hear your speech in these 2 days. Now, I welcome our next special guest. He is such a busiest man, such a very young guy who worked with our Indian cricket team, who got up early. Not for this, we had a student session. So we started by 6 o'clock. This is okay, 9 o'clock. We started by 6 o'clock in the morning. When we opened the Zoom, it showed his name. I thought somebody is going to make a prank. No, it was a real person. I welcome Dr. Ali Irani, sir. And I request you to give us few precious words to encourage all our participants and also our resource persons. Welcome you, sir. Please, sir.
Good morning, everybody. Thank you, Chandramohan, for your kind words. You know, the future lies in our country with the students. Because I remember when I was a student, we had only 7 physiotherapy colleges in India. And it was Mumbai, Vellore, Chennai, West Bengal, Delhi, Nagpur. And last 7th one came Baroda. And today you go to see, we have more than 300 colleges of physiotherapy, each taking at least 30 to 50 students. Some of the colleges take 80 and 100 students. It shows the popularity of our profession. No doubt, we had our teething problem. We had our ups and downs. And I feel that COVID was blessing in disguise. So it was COVID that proved that they would not be able to take care of the patients. They will not be able to put the patient back to normalcy without a physiotherapist. So today in Corona, in COVID-19, the whole country, physiotherapists are busy treating patients from day one. We are into prevention. We are telling all the patients, we are having regular camps. We are online classes for people. We know that one of the places where it attacks is the lungs. A lung can take 4.5 to 5 liters of air, and we can check it to the spirometer. But believe me, we saw 3,200 COVID patients. When we examined them, everybody's vital capacity was below 1.5 liter. It was below 1.5 liter. So one, our role to prevent is to increase the vital capacity of everybody. 2, the COVID patient, proning. We start with proning, increases the SpO2 level, the 6-minute test we are doing, positioning we are doing, making them walk, making them mobile, bringing them down from the bed, making them walk few steps, to increasing the vital capacity. It's job of a physiotherapist. So in short, I would say COVID was blessing in disguise. If we were cruising, now we are at a very high speed after COVID coming in. All the small centers, they are hiring physiotherapists. Government is hiring physiotherapists. And to put it all in vaccination, physiotherapists are helping, at least in Maharashtra and Mumbai. A lot of physiotherapists are into action for vaccine. So I feel our profession is on the high speed, and very soon I would label it in the best 3 profession in our country. One of them will be physiotherapist. And I wish all the students who are attending, all the physiotherapists who are there, I can only say, may God give you all a healing hand. And Chandramohan, thanks again for your team for this lovely way that they organize and on time everything going. I wish you all the best. And please excuse because I've got 9 o'clock
Yes, sir.
patient timing to be given. I have to just run to them.
Yes, sir. Yes, sir.
You and
Thank
all
you,
the
sir.
best. God bless.
Thank you, sir. Thank you for your words, kind words, encouraging words, and your kind presence also, sir.
I
Thank you
see
so
the
much.
recording. Whenever you send the recordings also, I keep watching them at late night.
Okay,
I follow
sir.
you all very well.
Thank you, sir. Thank you so much, sir.
God bless. Bye-bye.
Thank you, sir. Bye-bye. So here I'm going to announce call upon our next guest from our IAP. Sanju Jha sir has not yet joined with us. So I request Dr. Ruchi Varshani, Treasurer, IAP. Good morning, madam. I welcome you. You are not audible,
Good
madam.
morning, sir.
Yes, madam.
Good morning. Am I audible? Yeah.
Yes.
Thank you. Thank you.
Thank you. Oh, kindly spare a few precious words regarding our conference, please.
Yeah. Good morning, one and all. Thank you so much for inviting me. Though the duration was very short, but now I have come to know what was the journey that you all went through in the last 2 weeks. And I agree that this is such a gloomy period. This is such a period where we all were running after, beds. Healthcare was crashing, medicines, injections. I, being in Delhi, I know what kind of crisis the families have went through. We have lost our family members, friends, colleagues. Uh, in such condition, I can truly understand that what kind of pain the organizers go through when they organize such kind of things to make people aware, and such a noble cause. Meaning, it's like doing things to make students aware of what is the role of physiotherapy, to make the physiotherapist aware, as you said that most of us are musculoskeletal physiotherapists, and coming through the stage, it is the predominantly cardiopulmonary requirement. But now with the post-COVID conditions, as you all must have gone through, I just now came to know that Chandramohan sir, that IAP guidelines, everyone has gone through. And for the explanation part, I think you have got the best of the speakers. You have got best of the resource person. Annamalai sir is here. Then Maria ma'am is here. Narsimhan sir, Arun sir. They all are the people who have actually given their so many years in this cardiopulmonary department. So they are the best person to speak. I, being a musculoskeletal, I'm not the right person fitted here. But then, yes, it is, as Ali sir said, that physiotherapy is at a stage where we can actually get the attention of not only the society, media, government. This is the time where, everyone gave up, and it was a physiotherapist who was standing in ICU with the patient for 15 minutes at least, making that SpO2 coming from 74 to 92. And we are talking on evidences, we are talking on researches, we are not just hypothetically speaking, we are a branch of modern science, and that has been proved. And this is the need of the hour, that each one of you has to reach to the government, has to reach to the media, that what we are talking, physio is a branch of modern medicine. They have to accept it. We are a system of medicine, and the guidelines like IAP has given, this is all research based. These all are the people who are seeing the patients every day in thousands, and then framing those guidelines. So I would request, on the behalf of the Indian Association of Physiotherapists also, we are the largest, strongest, and the oldest association. And the need of the association was clearly seen in this period when, having all the state branches, having all the women's cell branches, a person sitting in South could get the, could know about their relatives in the North. We were arranging beds. Our teams were working for, getting the medicines, injections, helping each other out, because this is what association is all about, standing in the need, where we all were helping each other, where we all were taking stand for each other. And now it is high time that we should understand that a strong voice is needed, as NCHP bill has been passed in both the houses, and very soon we'll be getting our council. The council, it is a government body, so you need a voice to raise wherever our rights are hampered, wherever we need to speak. So I request you all to be to stay united, to stay strong with the association, to stay like the group, this EXRS group working. It is a very noble work, bringing students together, sharing the knowledge. This is something which is very, a few years back, it was not seen. Everybody was doing busy in their own work, spending time on their own. Personal growth was more important than the growth of the profession. And now the things have changed. Everybody is talking about the profession, everybody is talking about the association, about the team. So this should exist in physiotherapy, because there we were lacking. We were talking to the government in 10 different voices, and that is the reason still we were lagging behind. But now this COVID is, as Alisa said, it is blessing in disguise. So we can actually prove our worth with a strong voice, with a unified voice. And I, one of the, I being the national head of the IAP Women Cell, also would request all the women here. It is a women dominated profession. So a women can actually change the destiny of the civilization, I always say. So you all are very, very important, not only for your family, not only for your friends, but for the entire profession. So recognize the work to all the young girls. Keep connected, keep collaborating, keep communicating, whatever, wherever you need. You speak to the seniors in your states, and everyone who all are there operating on behalf of IAP, on behalf of other groups also who are working for the profession. You can communicate with them and make your profession proud. As Sir said, one of the best healthcare profession in the world. Thank you.
Thank you, madam. Thank you so much. I welcome all our resource persons. Mrs. Reshma Praveen has joined, and even Annamalai sir has joined. Okay, I'm welcoming another person. Actually, everything is set. All the resource persons was okay, fixed, and all those things. And I got a fear, okay, again to contact them, because I know all are busy. So I was silent for 2 days. Then I received a call, and he said that, what are you doing? Why are you silent for 2 days? You are wasting time, precious time. So do start again. I said, sir, I got fear to talk all the stalwarts. No. All are so good, and just make a call. Everything will happen. Go ahead. Like that, he patted me. Really, I got stuck. You just look at the list of the resource persons. I got fear to approach again and again. So he's none other than Annamalai sir, Dr. K. Annamalai. Sir, I welcome you, sir, on behalf of all our physiotherapists and EXRX India team. So we are happy to have you here as a special guest also from IAP side. And please, sir, give your precious words for our community.
So, very good morning to everyone, and it's pleasure to be here. I think before me, the National Treasurer has spoken, what you can call it as, you have a storm after that silence. So I'm going to talk in a very simple way because she has given a very wonderful thought process that how we are just traveling through this wave. And the moreover, Ali sir is here because Ali sir and Jas sir, actually they are working both internationally and nationally. During this critical period also, they are taking the IAP to the heights. So really, we have to salute to them for their work. Because if you want to deal with the kind of international affairs like WCPT, or if you take IAP, how we are going to go about it and how to form a national guidelines, always they were all are supportive. And they created the mark. I think out of 70 years, this is the first guideline came from IAP for a specific disease. So really, it is a wonderful work of lot of stalwarts who are working in cardiorespiratory, as well as the association, my EC members, and as well as my lovable president and my international affairs president, as well as the treasurer. Everybody has supported day and night. And it was a very critical point and crucial time. We have to support this national guideline as a first inspirational program. So it should not be have any stone should be turned out that it should not wrong or it should not have a bad impression, and it should have a create right documentation, because we are working now, the whole international community is looking for us, because the second wave was so desperate and it has been created India a space that we are the weakest nation. So during that time, because in everywhere the pandemic always, where you have a more spread, that country data will be taken care very well. So our international colleagues also looking for India, because in first way we look for China and Spain, how they are making and what is their guidelines. So now the India is time. So everybody is looking for our variants. What is our guidelines? So we are having more responsibilities for before starting this program. So definitely I'm saying that each one has contributed to that, and that guideline came beautifully and it is floated. Now that guideline become a what you can call it as a master guide for different people around the country who are even not cardiorespiratory. They can also practice simply. That is actually, we want to make simple and accessible, so many people can go and help. So it is not in need of a specialization. If you follow the guidelines, they can just work on, they can deliver to the community. So that guideline has helped many people to recover. So I'm really happy. And this conferences, these conferences are really going to help many people to get boost the confidence to go and see the patient and also to deliver the results on them. So really, I appreciate Chandramohan. Every time he think for something new, and in short notice you came. Only way we accepted, because it is pandemic and the topic is about pandemic. If it is not regarding the topic pandemic, definitely the short notice doesn't work. But here everything is under crisis, so we are accepting that. And Duna, again, she is not a therapist, but she is always supported the previous program also. And Annie and everybody, most of them, he's having a wonderful team. And best wishes for the program. All the best.
Thank you, sir. Thank you so much. And I welcome Mohana Krishnan sir and Bhaskaran sir, Maria Zindani madam, and Subramaniam sir. Yes, now I request one among our guests, from the very first day when I said, Madam, I'm going to organize and I'm going to take a few resource persons from your side. She said, okay, no problem. And till the moment, this morning, I received more than 30 or 40 messages. If there is any help needed, kindly send a message. For past 10 days, this is the message I receiving from her mostly. So I'm happy to have her one among our guests. I welcome Dr. Annie Thomas, Madam, from Bangalore. Madam, please.
Good morning, Chandramohan.
Yes, Madam.
Thanks for your kind words. I really so proud of you, and I'm I'm more happy because I am working with you all, and I'm proud to say that I am also one of the part of your team. Yeah. Actually, the best thing which I have seen in your team is it's as Annamalai sir said, it is not only a physiotherapy person, especially Duna madam, her contributions. It's like it's more than like even a physiotherapist does for you. So I think your team is the best team. And it is not only concentrating on a one aspect of physiotherapy profession or something or with the pandemic, but what when others are like what to do next, it's pandemic and what to do. There are patients less in musculoskeletal or neuro or whatever it is, it's only with the cardio or thing. But the best time and each and every day you have utilized and you have given the awareness of different areas in our profession through various ways like webinars, workshops. I think you had at least more than 10 participants in each of your webinars and workshops. That is 100% sure. Minimum, I can say 10. So that was the best in you. And I can see if you see the total participations, I think it's crossing more than 1,000. So it's like within a short period, your participants, their interest, their trust in you shows that how much effort you're doing for the professional community itself. And you've got the best people actually to say the speaker among your panelists. Annamalai sir, he's the best person. I can say Narasimhan sir also is very good in cardiorespiratory, because I know, like, even from my studies. So I think I cannot list out everyone, but I know you got a good list, and I know you can do well. We are, as I say always, we are all with you. Anything, any help, you just give a call or message. We are there for you. And all the best, and all the best for the participants and the resource persons. And I wish you all the best. Thank you,
Thank you,
gentlemen.
madam. Thank you, madam. Thank you so much. Here we are having one among our resource persons. I would like to call upon Dr. Maria Zindani, senior physiotherapist from Maharashtra. Madam. Good morning, madam.
Hello.
Yes, madam. Team EXRX India welcomes you for this COVICON, and we are thanking you for accepting our proposal in a short duration, and kindly utter a few words for our physio community during this time, madam.
So first, I would just want to thank you for your initiative, Chandramohan. It was very nice, when I heard you and you said you wanted to do something. You wanted to hold some lectures, you wanted to create awareness. There were a lot of queries, as you explained, and I like your humble approach. And I'm really, really impressed by your team, the organizing team, the way it has gone through and worked out on such a small notice. And getting in people, talking to them, discussing with them, everybody showed a very humble approach, and your basic interest behind the whole thing was get people understand, get people motivated, and help people. So all the best for your conference.
Thank you, madam. Thank you so much. We are honored with your presence also, madam. Thank you. Now I welcome another guest. Sir Veera Gautaman, sir, are you there? I welcome Dr. Veera Gautaman, Principal SRM, where I have done my PG in SRM during 2015 and 2017. That time Veera Gautaman sir not was there, but he helped us to bring students international resources for our webinars when we organized for World Record. Thank you so much, sir. We are happy to have you here today as a guest. And I would like to request you to utter a few words for our physio community, sir. Please, sir.
Okay. Thank you, Chandramohan. Thanks for your kind invitation. And I'm really astonished what you have made it. And the first time you have approached for this student activity, student for students, that was really impressive. Before that, see, as you made a wonderful job, before I addressing all, I started talking to you. So I would say that it was very much good. And before that, I would like to say my hi and hello to all the dignitaries. Few of the people I'm meeting first time through virtually. And thank you all for the opportunity. And Dr. Ali, Dr. Annamalai, Dr. Ruchi, and Dr. Maria, Dr. Annie, all the opportunities created by Chandramohan. Thanks for that, Chandramohan. And one thing I would say that, as Dr. Annamalai mentioned, that if there is a need, it is possible anywhere, everywhere. I strongly believe in it. It is not a matter of time or whatever it is. If there is a need, definitely that would happen. That is automatically that universe will support for that. In that case, I would connect that. In accordance with that, you found the need, you have made it, so it is going to be a great success. Once again, wish you all the very best for all the team members and the presenters. Thank you so much, and thank you for the invitation. On behalf of College of Physiotherapy, we will be here for you to support. Thank you so much.
Thank you, sir. Thank you so much, sir. And we have another 10 more minutes. So in this 10 more minutes, I would like to invite a few more guests. And I would like to welcome now Dr. Subramaniam, sir, Principal, College of Physiotherapy, Balaji College of Physiotherapy. Sir, are you there? Yes, sir. Good morning, sir.
Yes, sir.
We welcome you, sir.
Morning, Chandramohan, sir. We are alumni from SRM, and it's a wonderful job what you have been doing it.
Yes.
You know, the most important part with this series is the physiotherapist approach needs to be rewritten, the whole medical approach. You know why? There are nearly about 50 post-COVID patients, I happen to treat, involving maybe it is not only a cardio-respiratory setup. Maybe patients do have neurological complication because of cerebral hypoxia. They have muscular hypertonicity, and the cardio-respiratory part, they may have developed, adult respiratory distress syndrome, which is totally contradictory with the when you differentiate between the post-COVID ARDS and the simple ARDS because of other viral infection, the literature review, when I happen to see for publishing, it is entirely different. So even the approach by the diabetologist, by a physician who treats hypertension post-COVID, medicine, including physiotherapy, the rehabilitation needs to be rewritten, because that is what the evidence says. Whatever papers published when I was trying to support my findings, I myself got infected with the COVID in April. Probably I could understand how difficult, but I have prepared a self-made case history also that will also go for publication. The part what I'm making is the rehabilitation of post-COVID patients is something unique, right from every staff nurse to physiotherapist, maybe the neurologist, orthopedic surgeon. We need to study, update ourselves, because it is not going to be a capsulitis. It is not going to be a stroke straightforward. And medical management, even the rehabilitation, we cannot do a percussion for a patient, post-COVID patient, because here it is only ventilation perfusion, and the rehabilitation is totally different. And these people, post-COVID patients, are likely to develop more fibrosis because of restrictive airway diseases. So it's huge and it's timely. Let us update. Thank you for the wonderful opportunity. Thank you.
Thank you, sir. Thank you so much. Now, I welcome Mrs. Reshma Praveen, physiotherapist from Hamad organization from Qatar. Madam, are you there, please?
Hello?
Yes, madam.
Yes. Good morning.
Warm welcome, madam. Good morning. And we,
Good morning.
on behalf of EXRX India team members and all Indian physiotherapists, we welcome you and just give your precious words for our community during this time, madam. Adjust your cam, please.
Yes.
Yes,
are you able to? Okay.
Yes, madam. Yes, madam.
Yes.
Yeah.
Good morning to one and all. It is. I was looking at the esteemed panel, and I am definitely overwhelmed to be a part of this conference here today. I thank Dr. Narasimhan for giving me this opportunity to present in front of you. Whether it has been COVID in India or whether it has been COVID here in Qatar, we all have been facing a very difficult time, and definitely challenges that require us to again review our practices and in physiotherapy. But one thing is nice is that we are proud that we have emerged as a very, very important profession in this critical time. And during my talk, I would like to always tell you what a great experience it has been. It's a once in a lifetime experience. I hope we don't get an opportunity like this again. It has made a huge difference in our lives. So thank you so much for giving me this opportunity, and thank you for this day. Thank you.
Thank you, madam. Thank you so much. Now I welcome one of my professor, Dr. Vadivelan. Sir, are you there? Please come on cam, sir, please. Good morning, sir. Dr. Vadivelan. On behalf of EXRX India, we welcome you, sir. Okay, let us wait till he get connected with the video and mic. I welcome, how to say, he's senior most person, but very friendly. Whatever I do, he supports me like anything. I welcome Mohana Krishnan sir, physiotherapist from Jipmer, Pondicherry. Sir, are you there? I can see you, sir, in the list. Yes, so maybe he is busy in treating patients. So maybe he's watching. We welcome you, sir. And I welcome Dr. Sharavana Gari Ganesh. He's also my professor. And he is very good professor. His teaching is very nice. So I invited him also. Sir, Saravana Hari, sir.
Yeah, good morning.
Good morning, sir. On behalf of EXRX India team, I welcome you. And on behalf of all Indian physiotherapists, also, I welcome you, sir. Kindly give precious words for our community.
Thank you. It's really a good attempt, and to say at this time, it is very needy topic. So I wish you all success for this.
Thank you, sir. Thank you so much, sir.
Thank you.
I welcome Dr. Bhaskaran, exercise physiologist. He is MPT cardio, but he always likes to be called as exercise physiologist. So I welcome you, sir. He is also one among our keynote speaker. Sir Bhaskaran, sir. Meantime, yes, sir. Yes, sir. Please. Sir.
Yeah.
I think you are having network issues.
Not now. I think
yes, sir. Yes.
My voice is breaking.
No, sir. Clear, please.
Is it clear?
Yeah. Yes, sir. Yes, sir.
Yeah. Okay. I don't want to take much time because it's going to be 10. I think first topic
yes, sir.
is
Yes,
going
sir.
to start.
Yes. Yes.
And
yes.
I'm really very happy to be a part of team because I have seen from the start. Actually, last year, for past 2 years, I have been in contact with Dr. Chandramohan, and I'm very happy to be a part of joining for this COVICON as a part of a noble cause. And thank you very much for inviting me as a part of this, and wish you all the success. Thank you.
Thank you, sir. Thank you so much. We speak with many people, and we speak hundreds of people every day. Okay, we don't get inspired with everyone, but if anybody speak with Dr. Bhaskaran just for 2 minutes, okay, regarding exercises or exercise physiology or even cardio topics or any topics regarding to physiotherapy, you will get inspired. I got inspired by him, and just because of Bhaskaran sir only, everything has boomed. EXRX India. He was the one who officially inaugurated when we are having a workshop last year in Chennai. So he is the inspiration behind everything. And also Mohana Krishnan sir is inspiration for doing many free webinars. He did free workshop actually. More than 100 participants attended it. And I thank these people. I thank all the people who are available here in Zoom. If I missed anyone, please apologize me. Sorry for that. I think all are, yes. Yes, the person to whom I spoke with, he is also there, but I'm not going to tell his name now. Stay tuned with us. By 10 o'clock, within the next 2 minutes, we are going to have Dr. K.M. Annamalai sir session. Sir, Annamalai sir, please, sir, can we check for screen sharing? I request all our distinguished guests to stay online and watch our programs now.
Yeah, can you hear me?
Yes, sir.
Okay, fine.
Duna madam, kindly allow screen sharing so that.
Hello, sir. Kindly check.
No, it's fine. It's fine. I'm going to give a this thing. I'm going to explain in practicals, not issue.
Okay, sir. Then no problem, sir. The topic is myths and facts of COVID, and let me give official intro. Once again, I welcome all our registered participants for India's first ever international free e-conference, COVICON 2021. The theme is during and post-COVID physiotherapy care. So I request all the volunteers to be alert and all the participants to give your attendance, put your registration number and give a space, then your name, which was used to register. Okay. And again, I repeat, put your registration number and name. If you are giving any personal details, your certificate will be disqualified. We don't want your phone number or email. That is difficult for us to find your registration number. So put your registration number and name. So the first topic is myths and facts of COVID. So I personally thought that the resource person should speak without boundaries. So I didn't give any acute or any during COVID or post-COVID. So my personal choice is Dr. K.M. Annamalai, who is cardiophysiotherapist. Presently, he is HOD of Apollo Hospitals, Ahmedabad, and also is Chancellor for GRI. I welcome you, sir. There are a lot of things we can tell about Annamalai, sir. Not even this 30 minutes will not be enough. He is one among our pride of our nation. Okay, I welcome you, sir.
Yeah, thanks, Chandramohan. So already I spoken some formal things, so I'm going to go into the topic because I want to give some fascinating facts. That's the reason I was so happy that you have given me a topic of a generalized way. So because I'm going to share a fascinating facts, and more than the myth, it's an information which can help you to guide you in practice, as well as it is going to give you some new thought process of COVID. So first, I would like to congratulate you, and I'm going to go for my topic. Okay. So now, generalized idea is today is a great day. You all know that because today the India overtakes United States of America in vaccination program. So now we are the largest vaccination program in the earth. That means today we crossed 17.2 crore people of first dose vaccination compared to US of 16.9 crores. So today is a great day. So that day you have started this program. I'm really appreciate it. And the second point is, I would like to understand that regarding physiotherapy, if you go through the history of physiotherapy, every time during the challenges of the world, like a pandemic or epidemic or some kind of challenges, man-made disasters or nature-made disasters, during the time only, the physiotherapy has grown. So always the physiotherapy grows to the next level, or the version is updated next level during the time of challenges. If you want the evidence, I can share with you. The first physiotherapy has been grown during the Second World War, you all remember. And post Second World War, the physiotherapy needs are being more important and the people start to channelize. And second is, if you see leprosy, during the leprosy disaster also, you have that physiotherapy has grown in bigger size. And again, if you just go with the, apart from leprosy, if you go for a polio, so during the polio time also, the physiotherapy grew to the next level. And after polio, I think we have developed during what you can call it as the post-virals and other things has been started to improve. And last, right now, we are facing the challenge of the world is facing the challenge of the century, that is COVID. So during the COVID also, I think we will overcome the challenge and we will grow to the next position. So I think every disaster, the therapists are growing in the different size because the world is having an opportunity to believe us. Because we are actually more crucial because we all are what you can call it as crisis managers. So I feel proud that physiotherapy, and I feel proud to be a physiotherapist. The third point I would like to discuss now, what is the difference between first wave and second wave? So the first wave was in India. The people say that second wave, the country was not managed properly. So oxygen demand has increased and the panic has been is increased in bigger size. And a lot of things are going on. We have a lot of inputs daily regarding COVID. So here I'm not going to talk to you like kind of a prevention because we have just moved away from prevention. Now we all are experiencing the disease. And we know that most of our relatives are distant relatives because India is having 130 crore population. I think among 130 crore population, if you make it into 4 people a family, so it becomes almost 30 crore family. In 30 crore family, 0.1% also 3 lakhs people have been already died because of COVID officially. So minimum. What I'm saying means at least our relative or distant relative. So we all are experienced the heat of COVID through our near and dears. So we are in a very critical situation. So this is not a right time to talk about prevention because we have crossed that stage. The stage one, when we are talking on the phase one, we talked more about the prevention. But now we have to think about how we have to work smartly with COVID. So that is a way what I felt that will solve the purpose of the topic given to me, myths and facts. So first of all, more than the myth, I'm going to talk about facts, because when we talk about myth, the people sometimes they have it in the brain for a long time. So facts, if I talk that, if it is storing in our long-term memory, that is good. So I'm going to discuss more about the facts. Okay. Right now, the India is undergoing the second wave. So what is the signs and symptoms different from first wave and second wave? Why this is happening? And how, as a therapist, we have a challenges. And these are all the different kind of ideas. Immediately we start to think about it. So the first one is the first wave during the COVID, the people will get coughing, fever, body pain, fatigue, sore throat, and loss of taste and smell, all these things. But what are the additional symptoms added during the COVID-2 phase is pink eyes become red, and loose motion, hearing impairment, GI tract infection, and it is more contagious. Yeah, this is more contagious than the first wave. Why it is happened? So the people talk about genetics of the virus and genome of the virus and all those things. So I'll give you a small idea about it. It is easy to understand. Okay. So if you take the old virus, that is phase 1 virus, it has a different spike protein. Whereas the second virus, which is right now at present, which is actually at the wave 2, the spike proteins are different. So how come? So there is a variance they used to call. So variance means, suppose the first variant is less contagious. The second variant is highly contagious. And if you take Indian SARS-CoV Consortium of Genomics, what they say means it is a virus with concern right now in the second wave, because the spike proteins design is different, because the spike proteins have a different kind of number of spikes more. So more number of spikes, which is recently happening around the country. The Britain variant, the UK variant, which is having a less number of spikes to 7 to 8. But now in India, the variant which concern by the World Health Organization is having a more number of spike proteins, minimum 9 to 10. So the ACE receptors, it can go and lock, the chance of probability is more. So it become more contagious. That is the only simple idea I can say. So it is highly contagious, so it can spread very fast. So that's why it is a matter of concern. So the British variant, they call it as alpha variant, whereas what right now we are undergoing, they call it as a delta variant, right? So this kind of epidemiological change, this kind of genomic changes can change the epidemiology pattern. That's why India is going through crisis now, because the epidemic of the entire country is facing through, because the genome has changed. That is very important. And also, as a therapist, why we should understand means, I will tell you in ICU what are the variation happens between first variant and second variant, how we are going to take these points to be for our consideration as a practice of physiotherapy. And I think right now the whole country is stretching the healthcare infrastructure maximum then to the limits because of these changes in genome character. So, and few things in between, I want to share a fascinating fact. Now in second wave, everybody is talking about double masking. So as a therapist, first, our safety is very important. And moreover, if we are responsible citizen, we should not spread to others. So in between my talk, I want to explain about double masking. Okay, you have double masking means the people use two kind of masks. One is N95 mask. The other one is they use the normal surgical mask. So most of them, what they will do means, first they will put the surgical mask and they will use N95 above that. So which is a normal pattern of practice. Many people are using it, including many medical fraternity. But it is an unfortunate, because when you put a surgical mask and above that, if you surgical mask have some gaps. So above that, if you are going to keep kind of a N95, it is not going to seal the border. So what is the best idea of practice means, use N95 first, so it will seal the process, seal the area around your mouth and orofacial and nasopharyngeal area. All this area will cover. So then you just say blow, ooh, ooh. So the air should not escape. Then you use the mask of surgical. So this is a way how you have to use a double masking. So I think this tip will help you to save yourself as well as how while treating a patient. I think so. Okay. Next, I'll go for the next thing. So now we are undergoing the vaccine phases. So there is a lot of question about the vaccine phases. So Covaxin and Covishield, exactly what is the guideline by the government or ministry? The Covaxin is in between, you have a gap of 1 to 2 month gap can be no problem. Suppose the vaccine Covaxin first dose you have done and 1 to 2 months you can have a space and you can have a Covaxin second dose. That is not an issue. In Covishield is concerned, 3 to 4 months you can take. This is a guideline by the government, and which is we should understand that because many people will come and ask us because we are healthcare workers. So people will come and ask you, doc, tell me after Covaxin first dose when I should go supposed to. So we should be very clear with our thought process. Sir, if you are taking a Covaxin 1 to 2 months and Covishield 3 to 4 months, minimum gap is fine. So who should consult expert before taking the vaccine? Agar, if somebody is going to take vaccine, who we should guide them to go and meet expert? The simple idea is keep it simple. If anybody is having a clotting disorder or bleeding disorder, that is relevant to blood, clotting or bleeding, in both the cases, they should consult the expert before taking the vaccination. This is a very important, fascinating point, which definitely helpful for your practice. So bleeding and clotting disorder, if any patient is there, if they are approaching you, so how do you look for a bleeding and clotting means? You look for platelet counts and you look for a bleeding time, or you can look for a blood reports. You can identify that whether the bleeding and clotting problems are there. Definitely, and you should ask them to consult with the experts before taking the vaccine. And the people who are really the hypersensitive to the allergens like food, insects, pollen grinds, dust, and seasonal allergies. This kind of any allergies are there, they are also should go for have an expert opinion before taking the vaccine. Okay, there is a common question which I got regularly from my patients. I would like to share because here I am here to share the clinical ideas. Doctor sir, can I get my hepatitis B vaccine after taking the vaccine of or a flu vaccine after taking the vaccine of COVID? Yes, definitely you can take the hepatitis vaccine or flu vaccine, rabies vaccine. You can take any vaccine, but the minimum gap should be 15 days, which is guideline provided by CDC and ministry. So minimum 15 days after you can definitely go for it. And the one more common problem is I have taken already pneumonia vaccine. Already I have taken a flu vaccine. So I don't want this COVID vaccine. No, don't do that mistake definitely, because those vaccines cannot withstand with COVID, because the COVID family is H1N1 family and they are working in a different mechanism and they are mostly working in ACE receptors locking. So please don't avoid by saying that already I have taken a flu shots or pneumonia vaccine, so I don't want COVID vaccine. I think this is a one of the important area. And okay, somebody may ask you, sir, what the people who are getting vaccine also getting affected by the COVID, so why should I go for a vaccine? So you can say very clearly that, see, the vaccine, post-vaccine, yeah, you may get sometimes a chance, because actually vaccine has to prevent the entry of virus, but sometimes you may get it because of other comorbidity, or sometimes the virus virulence will be more, maybe. But make sure that today AIMS had a research and that it is exhibited in paper today's newspaper, that the vaccine of first dose at least can prevent the end organ damage. That means you can reduce the mortality rate, and also it reduces the contagious nature of the virus to spread others. So it is for good for you as well as for your family. So basically the vaccine save the end organ and also reduce the contagious nature of the spread. And one more thing, sir, in the US, we have seen recently in newspaper or in the news, that the government is announcing that once you get a injection, then you don't want to wear the mask. So is it possible in India too? No. In India, the government is recommended in Indian websites, ministry websites, it's recommended even after you have got your injections done, that is vaccines done, you should maintain the SMS, that is the social distance, mask, and sanitization. These three things you should continue. But according to World Health Organization guideline, they say no. This is a people where they get the confusion. In World Health Organization guideline, they say that once you get vaccinated, you don't require mask. And CDC, Center for Disease, they are also saying that you don't require mask. So this is a controversial myth and fact, I can say that. But in that case, what I suggest means we are land of law in India because Indian government knows what is exactly the ground reality of our country. So basically, whatever the guidelines given by them, first we should respect the law of land. So I think we should maintain SMS. We should not have a overconfidence that we have already done with the vaccine. So this is a very important point I would like to share over here. And the next important thing I would like to share with you is complications. So because right now the disease has already came and we are at the stage of rehab, the complication area, post-COVID complications. I think in between one of the principles, Subramaniam sir spoken about, the ARDS is different for post-COVID as well as the normal ARDS. Yeah, it is a fact. Because in post-ARDS of COVID post-ARDS, basically the infection spreads from peripheral to central. That means the peripheral area of lung to central part of the lung. So if you see the CT score of any HRCT, you can see that peripheral to central. So basically it is working on elasticity. Whereas in normal ARDS or post-pneumonia, if you see adult respiratory distress syndrome, which is without COVID, it is from central to peripheral, which is a parenchyma to outside. It goes outside. So the pattern is totally different. So the treatment method is also so different. So that's why what we are saying means in our national guideline also, IAP has clearly explained that yes, if you required only go for clapping. Because the reason is the clapping can increase the inflammation. So the clapping is only to dislodge if there is a sputum in it, and it is a mixed nature of both COPD as well as the restrictive lung disorders, along with sputum production is excessive, then it is guideline is recommending for clapping or percussion or any kind of mode. Otherwise, because most of the times we have seen in ICU that the patients are mostly why the proning is making wonders, because the reason is here the oxygen deficit is not so important. Here actually the vascularity matters because it is working on ACE receptors. ACE receptors are rich in vascular areas. So that's why you have a problem with kidney, you have a problem with the liver, you have a problem with that's why all the blood markers are up and down like D-dimer and all those things. So basically what is happening is the flow. So when you are doing a prone lying, what will happen means in proning, the maximum blood flow can be happen to all the areas and the posterior area will get more oxygen and anterior area of the lobes will get more perfusion. So ventilation perfusion is actually improving. So that's why immediately you can see the cascade of increasing in your saturation. So I can just remember an incident. So here one of our colleague basically is a scientist in ISRO. So he suddenly called at 4 o'clock in the morning. That time I was also with COVID. So we need a bed. So because his husband was basically going for a highly hypoxia, she is going below 80. The saturation curve is below 80, that is 79, 75 like that. So that time we could not able to morning 4 o'clock during that pandemic, it was very tough to get the bed. So we are trying with the bed with other hospitals we are talking, but his system is just lowering. And what happens means the next level, he started to go for delirium. Delirium means he started to speak blabber and irrelevant words. And he started to speak. That is actually a hypoxic brain. So he started to speak a lot of delirium. So they got more fear because they are non-medicals. So that time what I said means, you do one thing, you just make him prone lying until we are getting an hospital. So even that was my first hand experience that I'm just.
What I did,
do that. So they did it prone lying. So after proning, in half an hour they called, sir, it came to 90. So I was so happy. Okay, it was 90. That's great. So you just maintain, we will find out the hospital. So exactly morning 7:30, we got an hospital. We shifted him and he was in oxygen and he was just delirium got all right. And he was discharged after 20 days and now he is back to the job. So that time, the simple word at 4 o'clock that just make him prone, that created, saved a life. So I was so proud that physiotherapy work wonders, and which is actually I can called more than evidence-based practice. It is an evidence-informed practice which I have seen through my naked eye. It was an amazing experience I would like to share with you. So don't take it very, what you can call it as very carelessly that the positioning is not so good. The positioning is not very important. The positioning is very, very critical tool. So we should just give importance to it. And the next complication, if you want to talk, I will talk about LDH level. That is a lactate level. Many people post complication, if you go through the normal value of LDH is 140 international unit to 280 international unit. So these units are increased for many people. You can see as a physiotherapeutic way. LDH increases means there is a micro-inflammation at the distal vascularity areas. Because of that, the patient complains swelling, edema, as well as redness, and the patient feel that he is fatigued, he don't want to do any activity. So such kind of patients, the exercise should be taken care with full precaution, because if LDH is high means already the lactate is very high. So lactate is very high means he is already is going through the inflammatory phase. So during that time, the physiotherapy should be taken care very well. Because if you see in a music, if I'm just making a music, you don't enjoy. But if I just make a music up and down like that, then the rhythm sets. So similarly, in physiotherapy is concerned, where we can able to do the best, that we all know that. But we should know that where we should not suppose not to do anything. So that area will give a up and down voice of the physiotherapy outcome measures. So that will help the patient to recover very fast rather than doing it with a desperate. So don't desperate and relax yourself, you will get it. If you desperate, you will miss it. And the other area you should look for always a D-dimer. The D-dimer is 500, less than 500 is good. But if it is more than 500, it is relevant to mobility. So if you have a low mobility, definitely you are going to have what you can call it as high D-dimer rates. So what happens means a D-dimer and mobility is directly have a relation. So most of the people who are during the COVID time in home quarantine, what happens means they live in a small room 10 by 10. So they don't have a lot of mobility within the room. So they will have isolation. So they have a less mobility. So they will work with sedentary lifestyle more and more and more. And they will just sit with the computer or mobile or talking to someone and sleeping. So because of that small space constraint also environment can put pressure on you that you are not walking much or not moving. So that also can create an increased D-dimer. So what is my best idea means the D-dimer should be taken care as a therapist. You should take care. These areas should be looked into it. And the other area you should look means the renal complication and insulin intolerance. So don't worry about the diabetes which has came during the period, because one of the factor of the post-COVID complication is insulin resistance. So don't worry about it. So that is a temporary phenomena. And once the impact of virus is gone, and slowly that can be reversible. It is a reversible diabetes. So very important part is during quarantine, what you should look for. Two important things: oxygen saturation and temperature regular check. These are all the two key factors. Every 3 hours, check your oxygen saturation and temperature. And look into it after 5-6 days, the uncontrolled fever or lack of oxygen. Both of them are responsible for hospital admission. Only oxygen saturation down, you should not take care. Uncontrolled fever is also important key. So what you should have means, okay, you can ask, sir, D-dimer and whether we should go for what you can call it as movement regularly. No, even if you are in home quarantine, we are within the 10 by 10 room, you can go for a judicial micro movements. That means every half an hour. So what you can do means every half an hour you can go for a small movements like that. Okay. So that is a one area I would like to recommend. So next is what I feel means the other area is 1 minute.
Yes, sir. Please take. Sir.
Yeah. Actually, okay, fine. Right. So I got a phone in there. That's why. Sorry. So yes. The emergency, the physiotherapist golden key is prone position, and don't forget about the proning. And the second one is good hydration and micro movements, judicial micro movements during the phase, and post-COVID complications you should look for, depends, you should design. See, this is cannot be capsulated protocol. Try to understand, because it's an evolving disease. So disease is changing its phase. So what we have to do means that it act in each patient in a different spectrum. So you cannot go with some patients, they have a peripheral neuropathy. Some patients, they have a GBS. They have a renal dysfunction. So there are a lot of spectrum is associated with this. And muscle wasting is one of the commonest area which I've seen in many patients because sarcopenia. So I think you cannot stop this. Okay, these are all the protocols you should look for. I think the therapist should design the protocol depends on the requirement based on the guidelines, because the guidelines are just what you should, these are all the things, but it should be tailor-made program, depends on the requirement of the patient. I think that will help you to give a outcome measures. And I think I have full faith during this COVID period also, definitely our physiotherapist will reach to the heights, and definitely already we have proven many many places. And now the physiotherapy is looking very serious, everybody, including doctors, physicians, and everybody. I think our council is also on the pipeline, as already it has been what you can call it as gazetted. So I think we are in a good peak with a bad time. Yes, we will overcome. And with that, I'm just completing my talk. Thank you so much for the opportunity. And yes.
Yes, sir. Thank you, sir. Thank you so much. You have started with the differentiation between the first wave and second wave, and whom to consult, especially. Even we physiotherapists doesn't know, even when our family members are have any comorbidities, to whom we can consult, whether we can go directly for vaccination. You have answered clearly for that, to whom we have to consult before taking vaccination. And you spoke about ACE receptors and its importance, and prone position. That's a golden key. And that prone position saved the life. You shared the experience of saving a life. That's why physiotherapists are called as COVID warriors. And another one more important point you mentioned is every 30 minutes there should be judiciary movements. That yes, every 30 minutes we should break sitting, or we should break lying down for longer duration, and good hydration. It was like it's a package, sir. You gave all the details which needed, so that the physiotherapist can tell now others that in a right guidance way, right pathway. Okay, if you have this, go and visit. If you have this, go. In emergency case, go for prone position. Before that, many of us do not know why prone position. And what we know is little. And now you have cleared it very much with the explanation, sir. Thank you so much. I would like to take questions, sir, actually. Let me check in YouTube. Rupesh, can you please?
Yes,
dear
sir.
Participants, you can post your queries. We are having another 15 minutes to discuss, and we will be giving you the separate link, YouTube link for the second session. So kindly stay with us. and we will be posting the link also. If you have any queries to ask our honorable resource person, Dr. K. M. Annamalai, kindly write in YouTube comment section. We will read it here. You will get the answers.
Yes, sir. Firstly, thank you for the session, sir. And a few thank you and appreciation messages were in WhatsApp and in YouTube, sir. The first question is from Mr. Akhil Santosh. For those individuals who are already consuming steroids, is taking vaccinations are indicated or not, sir?
Yes, during the steroids, yeah, definitely it's a good question. If suppose somebody is arthritis, they are taking a long-term steroids. So in that case, I think you should look for thrombocytes, how the thrombocytes are. So you should look for a thrombocytes determination, then you should take a decision to go for steroids. Suppose if they have a thrombocytopenia or something like that of overuse steroids, or already immune system is so weak, so definitely they should consult with the expert, then they should go. And if it is a short-term use of steroid, there is not an issue, because in COVID also we are giving a short-term use of steroid. But people who are having a long-term, because definitely therapists will come across with rheumatoid arthritis and people like that. So definitely we should have a concern about it. If they are using a long-term usage of steroids, definitely matter of concern.
Yes, sir. Second question is from Mr. Devyas. What precautions we have to take with increased D-dimer?
See, when there is a D-dimer increase, that means the stagnation of blood is there. The blood is not so thick, so thin. So it is so thick, so it is turbulence and it is not moving properly. The stagnation is nothing but your sedentary life as well as the increased blood thickness. So what you can do means, for blood thickness reducing, we can go for a blood thinner medicine like Ecosprin and other things under the guidance of medical. And apart from as a therapist, the mobility can induce. If you are going to move much, then the D-dimer can have an impact. So exercise is an answer.
Yes, sir. Third is from Ms. Revati. How about pregnant women care?
See, in pregnant women, actually, the guideline which was given by our ministry and the CDC has said that the pregnant women as well as lactating mother should not go for vaccination. But right now, that has a old guideline, but recent guideline, they said that, yeah, the lactating mother can go for vaccination by ministry, but it was not updated in website. So I cannot say that it is, but it came in paper. The lactating mother as well as the pregnant can go for it.
Yes, sir. Fourth one is from Mr. Prakar. What about vaccination for COVID-19 positive patient?
Yes, it is definitely a beautiful question. If you are in positive stage, you are active case, please don't take vaccine. And once you get activation is completed, you become negative also, at least wait for 3 months, then you go for vaccine. And after 3 months also, you check for antibodies. If antibodies are so high, you can have a good period of waiting, no issues. But definitely during the active stage, you should not supposed to go for vaccine.
Yes, sir. Fifth one is from Divya. Sir, can we take painkillers for any other pain after COVID vaccination?
What I feel means ibuprofen should be avoided. You can take a simple paracetamol, and the ibuprofen should be avoided for 24 hours to 48 hours. So that is what the basic idea is. And apart from that, you can take a paracetamol.
Yes, sir. Sixth one is from Ms. Sumita. If patient is ventilated, what kind of physiotherapy is advised, sir?
So if the patient is on ventilator, so the best is positioning, and it is an inflammatory disorder. That's why I'm saying that unless if there is nothing dislodged or something like a sputum or something, don't use clapping. The clapping is not directly advised. Positioning will help you a lot, and diaphragmatic scooping can help you. And also just basal breathing and other things rhythmically, you can work along with the breathe of the machine. And these things will help. And don't exercise more in the patient in ventilator, because the risk-benefit ratio is not so good.
Yes, sir. Next one is from Ms. Shem. So what about vaccination for people with multiple drug allergy?
Yes, multiple drug allergy. Some people have an insect allergy. Some people have a food allergy. And some people will have a allergy due to dust and pollens and mites. So these people definitely should have an opinion about with the pulmonologist or somebody, then you should go for, because the allergy is one of the major cause for post-vaccine problems. It has been well documented.
Yes, sir. Next question is from our Zoom participant. What is the protocol for people who already have high D-dimer level post-COVID, sir?
See, high D-dimer level, if it is the D-dimer level is increased at the terminal end of the stage, that is 13th or 14th day or 15th day, then you should be going for, suppose more than 1,000, 2,000, 3,000 like that, you should go for an injection along with exercise. And if it is around something like 700, 800, then they will start with the ecosprin orally. And with that, they will start to do the exercise. So you can start the rehab, because D-dimer, in D-dimer high, the exercise will help you.
Yes, sir. And one more, next question is from our Zoom participant, from Dr. Vijay Selvan, sir. Rationale for steroid usage in a patient with DM and CKD and its impact on physiotherapy intervention, sir.
Sir, actually, steroid, CKD full form, can you explain? Because chronic kidney disease you are talking about?
Yes, sir, I think so, sir. Diabetes mellitus and chronic kidney disease.
Okay,
Yes,
okay, diabetes, yeah. So chronic kidney disease and diabetes mellitus, long-term usage of steroid. So in that, he want what is a vaccine? You want to ask the impact of vaccine? Physiotherapy intervention is talking. Question, can you, Rupesh, can you repeat the question?
He is there, sir. He is there.
Yeah.
Good morning, sir. Annamalai, sir.
Yeah.
Rationale for using steroid when a patient is being admitted with COVID complications, who is already having a comorbidity of DM and CKD. So again, usage of steroids, it will elevate the blood glucose level, and also kidney functions will be affected.
Sir, always steroid is a double-ended knife. We can kill a patient and we can save a patient. So depends on the day and depends on the patient condition. They should decide on risk-benefit ratio. If risk is more, benefit is less, definitely no steroids. Suppose if the benefit is more, whereas the risk is less, definitely they should go for steroid, because it is purely on, that's why I'm saying it is a disease of uncertainty. COVID is a disease of uncertainty. Nobody can capsulate inside the protocol. So that's why I'm saying the steroid usage should be judiciary based on risk-benefit ratio assessment of the particular patient. Second one is physiotherapy intervention. Yeah, definitely in case of diabetes mellitus and also this thing, you can passively, stimulate the muscles. So because there is a lot of sarcopenia, that is muscle wasting will happen during the time. And also what you can do means the other positionings and diaphragmatic activation, all those things you can work on, and breathing workouts, and humming is one of the good exercise. You can create more humming through the nose rather than mouth, so which can increase the nasal sinus, as well as it can increase the nitrous oxide level, which help us to vasodilation of the vessels. So I think you can give exercise, definitely.
Yes, sir. Next question is from Ms. Hedvi. How prone lying, one second, sir. How prone position will help, sir? Can you explain it again?
See, in prone position, what will happen means, actually we have a lungs. The lungs, the major portion is posterior lobe, not an anterior lobe. So 60% of our lungs, the bigger area is posterior lobe. So when we were just sitting on support or lying in a Fowler's position, the posterior lobe is having a restrictions to the enlargement, or actually kind of elastic nature has been reduced. So when you are lying prone, what happened means, due to gravity, all the blood vascularity has been improved at the anterior lobe, whereas the posterior lobe, the air can go and pump and it can expand and it can improve the elasticity. So that is the reason your saturation is picking up. So your ventilation perfusion is getting matched more.
Yes, sir. Next question is from our YouTube viewer, Ms. Lavanya. What about cardio patients and pregnancy COVID positive patients? How to position them, sir?
See, in the positioning, the pregnant patient and cardio patient, I always advise make them, instead of prone lying, just make them on the left side lying and Fowler's position. They both are good.
Yes, sir. And next question is from Mr. Suresh. Sir, what are the warning signs to stop physio during COVID management?
The warning sign is desaturation. See, when you are giving exercises, if the saturation is going down, or when you are doing a percussion, the saturation is going down, and once it's not coming up back again, then it is. Normally, the saturation is based on oxygen dissociation curve. What is oxygen dissociation curve means? Normally, in our body, if it is the saturation is about 100, so our actual saturation, ventilation perfusion saturation is, that is actually the ratio is basically what you can call it as 94. And below 94, and the saturation drops means definitely there is a changes at the cellular level and vascularity level. And above 94, how much it is increasing, that doesn't matter, because after 94, the oxygen saturation curve get desaturated. That's why we kept 94 as a standard format for hospitalization. They required oxygen help. So this is one of the area. And second one is a continuous spikes of fever. Please don't touch. If a spikes of fever is high, don't do any movements there. Rest will heal, because the body is going on active phase of inflammation. And the patient is on ventilator and the patient is in ICU. You look, even a small movement is desaturating. Please avoid movements. Better that they can improve with the positions. So these are all the areas, red flags you should look for. And yeah, I think so.
Yes, sir. Next question is from Ms. Neha. Sir, would you comment on mucormycosis? Why the cases have been reported more in India?
See, mucormycosis is normal only. Everybody, every time it is there. But our immunity is going such a low level after COVID because of overuse of steroids or overuse, highly, insulin resistant diabetes due to overuse of steroids. So our immunity is going such a low level where even the fungus can come and enjoy on us. So that's why we got a mucormycosis. But mucormycosis is not a contagious spreading disease. It is based on their own immunity. So I think if the immunity function is good, so definitely mucormycosis. So it is not a panic threat, but definitely it is a matter of concern, black fungus. So we should take care of it. And previously they said that actually the use of industrial oxygen or usage of improper hygienic continuous mask and other things are the reasons. But they have now taken that out. Now they are saying that it's purely based on your immunity.
Yes, sir. Next question is from our Zoom participant. Few patients have SpO2 between 85 to 90. Can 6 METs be done in them? If yes, what should be our lowest limit of SpO2, sir?
Okay, what you are going to do means first 85 to 90, make the patient, suppose the patient is with oxygen, without oxygen, first you look for. If it is a patient is mostly 85 to 90 means they will have 12 hours to 8 hours of nasal oxygen supply in the night in the home. So such a patient, you can just work with the nasal oxygen, you can start to work. During that, every minute you should look for watching your saturation probe. If the probe is just going down and the patients, there are two ways. One is the probe is going below 85 or the patient says that, yeah, I cannot do it. There are two things you should look for. Or the patients will have a box score changes. So box score changes, all this thing, if you can able to witness. So I think he cannot complete the test on 4th minute, 3rd minute, 2nd minute, you can stop. Suppose some patient completed total 6 minutes, you look for which minute the lowest saturation is there. So that minute, that is a maximum peak load of its saturation. Based on that, you should decide that further 6-minute walk test when you should add or when you should do.
Yes, sir. Next is cause and treatment of constant dry cough in post-COVID patients.
See, it is an ARDS, adult respiratory distress syndrome. It causes a pneumonia. So pneumonia, the cardinal sign is dry cough. So in the dry cough is concerned, you don't want to do anything. It's a resolution phase once it happens in this thing, so it will go down. But some people will recommend for steam, keep the pathway moisture, yeah, and drink enough amount of hydration, water, that can help, and the prone lying will help. And these are all the certain things you can work on it. And apart from that, dry cough will subside by itself once the resolution in the lungs start to work on it.
Yes, sir. Next is from Ms. Pooja. What is the main difference between COVID rehab in first wave and second wave in specific, sir?
See, in first wave, the contagious nature is very less because it has a less spikes, whereas nowadays the variant, double mutant variant have a maximum spikes. That is a one area. And what is the rehabilitation perspective means? In first wave, we gave lot of movements inside the wards and ICU that has helped to improve the oxygen and increase endurance. But in second wave, we have to assess the risk benefit ratio. Based on that, less movement and more position will help us to recover the patient fast.
Yes, sir. Next question is from Ms. Vedansh. If a person is already performing duty in COVID ward, so now is it good to get vaccinated because patients are getting positive after vaccination?
See, any given day, healthcare workers, definitely we are the frontliner warriors. We should go for a vaccine, definitely at any cost. Even because nowadays the patients are not only in wards and ICU, the patients are nearby you and your neighbors also. I think it is always precautionary measure to go for vaccination.
Yes, sir. And next question is from our YouTube viewer. In early vaccination period, the difference between first and second dose is 28 days, and nowadays it is 84 days. Why is it, sir?
So this is based on the ICMR guidelines. Based on that, because they are keep on doing. That's why I'm saying this disease is not a permanent disease kind of. Same time, it is not a temporary disease, and this disease is not can be capsulated within the brackets because it keeps on evolving. Because the virus is also developing, our immunity is also changing. So it is evolving disease. So today, whatever statement I'm given may be changed after a month because the new guidelines can come. So what I'm saying means a basic idea we should have, and I think the new things should be added on it. So what the vaccine companies as well as the ICMR is actually decided based on some research works.
Yes, sir. Next question is from Mr. Ravi Kumar. Sir, can we lay a pregnant woman in prone position when SpO2 is low?
Again, I'm saying that only, sir. The prone position is not at all good for a pregnant woman. And if she is having an attitude of sleeping before itself, she can sleep. Otherwise, you cannot introduce newly during this time. But instead of that, you can give a semi-prone position on the side lying kind of 45-degree the body where you can keep pillows and support. So that is left side lying is better, because the placental circulation will be improved if you are keeping. It won't have any problem if you're keeping left side lying in a 45-degree position.
Yes, sir. Next question is from Ms. Neha. Please explain more about the clapping. Why it's not recommended in post-COVID?
See, it's not mandated. It's not. I'm not saying it's not recommended. It is. See, if I know one technique, I can use in all the people the same technique. No, we have to be very critical about diagnosis. Based on the diagnosis, I'm not saying that the clapping is contraindicated. But the second wave, the clapping doesn't help much because already the inflammatory process is in peak. Basically, here the lack of oxygen is happening because vascularity inflammation. So vascularity inflammation can increase. So better is we want to reduce the inflammation. That's a one area. And second area is if definitely the sputum is a major chunk reason for the patient in ventilator or ICU, definitely you can go about it. What I'm saying means when it is required, you do it. See, it's something like you have all the instruments, but which instrument use it for which condition, that is important. You cannot that's why I'm saying here there is no protocol. Here it is based on the design each individual of the body. It is not a common protocol. Try to understand.
Fine, sir. Next question is from Dr. Vishnu. Which form of COVID is danger, whether symptomatic or asymptomatic?
See, asymptomatic is dangerous for the public, and symptomatic is dangerous for themselves.
Yes, sir. Is there need for mask on for asymptomatic COVID patients?
Definitely mask is must for everyone because our Indian guideline says that even if you have gone for a vaccine, you please use the mask. And even your post-COVID has done, still you use the mask. But CDC and World Health Organization says that once you got vaccinated, you don't require a mask. It is a gray area between the CDC, World Health Organization, Indian ministry. But we are being in India, our ministry know more about our local conditions, so we have to follow that recommendations.
Yes, sir. Next question is from Ms. Rishika. What physiotherapy treatments can be advised for post-COVID patients with comorbidities after a month or more?
It's not required a month. Even after 2 weeks, they can start the rehab. So it's not required, and you should design the exercise based on the comorbidity. So comorbidity and oxygen saturation and the heart rate See, many patients, you should take care of one of the things. The many patients post-COVID, they have anxiety and gastritis, and they have a problem of variation in heart rate and variation in BP, fluctuation in BP. So don't get fear. It is a very common in post-COVID, and you should just consult with your physician, and you can keep on go ahead, no problem. Because the virus is attacking the ACE receptors. The ACE receptors are responsible for controlling BP and heart rate.
Yes, sir. Next question is from Ms. Amulya. Mild hypertensive patients can be vaccinated, sir?
Definitely, no problem.
Yes, sir. Next one is from Mari Muthu. Sir, how about vaccination for children with developmental disabilities?
See, we are not started even for a small child because it's in phase 3. So once it completed only, we will know in normal children, then we should think the disabled children doesn't make a difference between normal children. They are differently able, that's it. So, but once we go through the 3rd phase only, we can give comment on that.
Yes, sir. And next question is from our Zoom participant. So what about the vaccine, the patients who have a comorbidities such as hepatitis B positive?
That's why I said in my speech, you can take hepatitis B vaccine, or you can take your rabies vaccine, or you can take your any vaccine after 15 days, 2 weeks of your normal, your COVID vaccine.
Yes, sir. Next question is post-COVID, how long we can take steroids, sir?
It depends upon your CRP. You check for CRP, C-reactive protein. If C-reactive protein is below 5, then you can just mutual consent with your physician, you can stop, because it's a temporary need of steroid. It is not required a permanent need.
Yes, sir. Why 2 doses of vaccine is required, sir?
First dose is a dose which is creating. Second dose is called booster dose. That is actually to augment the process.
Yes, sir. Next question is from our YouTube participant. Sir, why surgical mask over N95 is more secure and protective? It was an amazing session.
Because if you wear, what I said means use first N95, then you use your surgical mask. Because N95 will seal all your borders, so no air will go in or come out. Then you use the double mask, use the surgical mask, which is one more layer of prevention. But most of them use first the surgical mask, which is more comfortable, and second they use the N95, which is not a right way of doing it, where you will get a gap. So there is a chance of penetration of virus instead.
Okay, fine, sir. Next is from Ms. Sangavi. Autoimmune diseased patient can take vaccination?
Definitely they can take it, unless if they are not using a long-term steroids.
Yes, sir, Rupesh,
okay.
We can wind up this session now, and we will be get ready for next session by 11 o'clock. And I would like to welcome our guest, Vijay Selvan, sir, Dr. Vijay Selvan, principal of a college from Kerala. Sorry, sir, I didn't notice you because there are a lot of lists here. Unknown persons are also joined in our Zoom link. Sorry for that. Sir, please give us your precious words, sir.
Morning, everyone. And good morning to Dr. Annamalai, sir. That was a wonderful session. You have given the insight to almost all the queries which has been asked from the participants, including mine. And it was a great start indeed. And talking about EXRX team, I don't have much words because it's going on like a linear pattern of study for all of us. It's a linear pattern of study, everyday pattern. We learn every day, and EXRX team has been the stepping stone for many of our counterparts and to the students in India and across the world and globe. So you are doing a wonderful job. And at this point, I would like to just put my insight on one aspect. So regarding this COVID scenario, so let us see this COVID rehabilitation in a biopsychosocial model. So which is very highly required and need of the hour to treat the patient in a biopsychosocial model, not only with the biological recovery. Many of the patients are not finding people to talk to share their thoughts who are admitted in the hospitals and centers, and they are both downtrodden with both psychologically and sociologically. As we all are aware that stress forms a major factor in developing the antibodies and to develop the immune system. So I urge all my counterparts to do a biopsychosocial approach in treating the COVID patients, both during and post-COVID patients. Nowadays, we are getting most of the post-COVID patients to our centers. So that is my insight on it. And thank you for having me here in a wonderful platform. My hearty wishes for the success of the session for today and tomorrow and henceforth. Many sessions to follow. Thank you so much.
Thank you, sir. Thank you so much. Once again, I take this opportunity to thank Dr. K. Annamalai for a wonderful speech. And this is what needed in this current scenario for the physiotherapists, because many of many of us are sitting at home. We don't know how to respond for the queries also, like me. And thank you, sir. Thank you, Vijay Selvan sir, for joining with us. And we will be having the next session. Next link will be posted in respective groups. And I request everyone to join. Thank you, Annamalai sir. You were disconnected. Still, we are expressing our thanks so much. We are signing off now. We will be meeting within next 5 minutes.